Can you cure obesity? What happens when you stop taking Ozempic or other GLP-1 medications? And do you regain weight? Who should not take GLP-1 medications? How do you know if you have metabolic syndrome? Is it possible to increase your metabolism? For those who don't know me, my name is Dr. Esra Shermadou. I'm a board-certified family and obesity medicine physician, and I'm the founder of Sakina Health here in Dayton, Ohio, where I help adults lose fat safely, preserve their muscle, of course, improve their metabolic health, and build healthy, sustainable habits to help them live healthy, long, strong lives. I love what I do. I love working with adults to help them achieve their goals and watch them along the way come out stronger and more confident and ready to conquer the world and beyond. So if you're struggling with your weight or struggling to feel like yourself again, definitely reach out, book a consultation call, and let's talk. To answer some common questions about weight loss, GLP-1 medication, strength training, and I've been getting a lot of the same questions, and so I thought it'd be great to just come on here and answer some. So the first question, can you cure obesity? What happens when you stop taking Ozempic or other GLP-1 medications, and do you regain weight? So this is a great question. So can we cure obesity? Well, this is a little bit complex, but I'll try to simplify it. So we know that obesity is multifactorial. It's caused by many different things. It's not just about how much you eat and how much you move. We know that genetics can play a significant role in obesity. Hormones can play a role, and we have hundreds of hormones involved. The environment that we grew up in, the environment in which our mother grew up in when we were, when we were still a fetus, that plays a role. So many different things. So ultimately it depends on what is the cause of your obesity. And oftentimes it's multifactorial. And so I think we can do a lot of things to improve obesity and maybe, cure it depending on what is the primary cause in your case. So for example, if lifestyle plays a factor in the reason why you're carrying excess weight, for example, maybe you moved away to school, you're living on your own for the first time, or maybe you just had a child and there's a lot going on in life. You're not sleeping, you're, trying to care for this new baby, and you don't have time to go grocery shopping or cook meals or go to the gym or anything like that. So in those situations where maybe your life's a little bit different and you don't have time to implement some healthy lifestyle habits, then I think improving those factors will allow you to, cure obesity. But in other situations where genetics may play a larger role in your situation or other things, then, I think with the use of some anti-obesity medications that we have access to these days, I think it helps us control it better. When it comes to, do you regain your weight if you stop GLP-1 medications or even some of the other anti-obesity medications that we have? I think if you improved your lifestyle habits while taking these medications, which is absolutely crucial, you can improve or decrease the amount of weight that you regain. But studies do show that when you stop these medications, you will regain some weight after some time. And how much weight you regain will depend on, how much of the lifestyle habits you improve. So are you eating, more nutritious foods now? Are you, more active and going to the gym, working on your strength training, building muscle, and getting some aerobic exercise in? Because if you're doing these things and you're controlling your stress, you're sleeping on a consistent basis, no one's perfect and is going to be able to do these things every single day. I mean, if you are, props to you. But if you're consistent with your habits, then I think you can limit the amount of weight that you regain. And so that's going to play a significant role. But if you just kind of started these medications and didn't change anything about your lifestyle, you're still eating unhealthy processed foods all the time, you're not exercising, you're not really moving, then yes, you are going to regain the weight that you lost. And sometimes adults, or people regain even more weight. We do see that with chronic yo-yo dieting, is that people tend to regain more weight the more times that you go through this cycle. So, can we cure obesity? Depends on the ultimate cause. And do you regain weight after stopping these anti-obesity medications? Depends on if you are improving your lifestyle habits while taking these medications. You should not take GLP-1 medications. So GLP-1 medications like Ozempic, Wegovy, which another name for it. Ozempic is used for diabetes primarily, Mounjaro for diabetes, Zepbound for weight loss. So we'll start with who should not take, or who these medications are indicated for. So adults who have a BMI of greater than 27 and have an associated weight-related condition like high blood pressure, diabetes, high cholesterol, you can take these medications. Adults who have a BMI over 30 also can take these medications. And then, of course, if you are diabetic, you can take these medications as well. And there's other conditions too that some of the medications are qualified to treat as well too, like obstructive sleep apnea, some severe cardiac disease as well. So those are the main indications or reasons why you would qualify for these medications. Reasons why you should not, or people who cannot take these medications, would be anybody who is breastfeeding or pregnant. We just don't have enough studies to say whether or not it's safe for pregnancy or for the fetus. And so it's not recommended that you take these. If you have a family history or personal history of medullary thyroid cancer, then you cannot take these medications at this time. History of pancreatitis or certain GI conditions like gastroparesis, because we know that these medications do work in part to slow the digestion of foods. And so if you have some of these conditions, it can lead to some significant complications. And so in general, the things that if you have these conditions, you should not take these medications. Of course, do not start these medications without talking to your doctor or your provider, because every situation is going to be a little bit different. How do you know if you have metabolic syndrome? A lot of times we throw out the term metabolic syndrome, metabolic conditions, and I don't know that many people know what these conditions are. So metabolic syndrome is generally a group of conditions that if you have these conditions or this criteria, it increases your risk for developing diabetes, heart disease, stroke, and other chronic conditions. And so when it comes to metabolic syndrome, you're classified of having this syndrome if you have 3 of the following. So if you have a waist circumference of greater than 35 for females or greater than 40 for males, if you have elevated triglycerides, which is a component of your cholesterol panel, if you get that, if you have low HDL, which is your good cholesterol, if you have signs of insulin resistance and high blood pressure. So of those 5, if you have 3 of the 5, then definitely you have metabolic syndrome, and therefore you are at risk of developing, some of the other conditions that that I mentioned before. And so that's something that you want to be aware of. And the good thing about metabolic syndrome is that these things are reversible through diet, exercise, stress management, medications as well too. We use those to help control these conditions, because, there is a component that could be genetic as well too. And so lifestyle plays a significant role, but sometimes you have to use medications, and, that's a conversation between you and your doctor or your provider. Is it possible to increase your metabolism? One of the greatest ways that you can increase your metabolism, of course, is through strength training. So we know that, if you build muscle, you're going to increase your metabolism at rest, and therefore also when you're doing activities. So that's one way to do it. And this is going to, something that you do over time. It's not going to be an overnight thing, but in the long run, it serves you very well. Another way to increase your metabolism day to day is going to be, even walking or just general movement that you do day to day. Those are small little ways that can help increase your metabolism on a day to day aspect. Eating like protein is also going to help increase your metabolism a little bit as well too. So those are kind of like the main things that I think about when talking to patients about ways to increase your metabolism. Of course, the muscle building is going to be the number one way, because that's going to be, something that's going to continue working for you, over the years and years. And then, of course, going back to that really quick, sleep, of course, making sure you get adequate sleep, burn calories when we're sleeping. And when we get adequate sleep, that kind of allows everything else in our body to work optimally, and it's able to help control our hormones. It allows us to recover so that we can build muscle as well too. So that's, an indirect contribution, but very important. Question: signs that your caloric deficit is not working. So we talk about caloric deficits primarily when we're thinking about losing weight. Usually, a lot of people say, calories in versus calories out, and that's how you lose weight. But there's so much that goes into it. So when a patient comes to me and they're like, I'm decreasing my caloric intake and I'm still not losing weight. So the first thing I have them do is just kind of really take a good look at what they are eating. Just awareness is so big. So just being aware, do you find yourself adding creamer to your coffee? How much creamer? Are you adding sugar? How much sugar? Are you adding dressings to your salads? Are you adding breadcrumbs or frying your chicken? Are you cooking your eggs in butter or oils or anything like that? Just small, are you eating after your kids? Are you picking out their plates or picking while you're cooking meals? Because, if you're in a caloric deficit, it's important that we're extra aware of all of these things because they do add up throughout the day. They can add hundreds of calories. And when you're trying to lose weight, all of that plays a role and, can contribute to your weight loss. So that's number one, just kind of taking a look at what you're eating. Number two, what are you eating? So are your meals made up of adequate protein, fiber, whole foods, slow digesting carbs, healthy fats? Because that also can play a role. So, I've had some patients who, when we look at the breakdown of what they're eating, number one, they realize that, maybe they're not tracking as well as they say or think that they are. And number two, that they are actually not thinking about the things that they're adding. But then looking at the breakdown of their food, I can see that sometimes they're not eating as much protein as they think they are. And they're actually really, really, really low on their protein. Or they are going by protein goals that are noted on like MyFitnessPal, which is not always the most accurate and tends to underestimate your protein goal needs. So in general, I tend to aim for like the 1 gram per pound of body weight or ideal body weight. And, I'll work with individuals because that can also be a little bit different for everybody. And so that's important to consider too. But that in general, that's kind of my rule of thumb. And so sometimes if we just kind of change your macros around, so you're eating more protein, maybe a little bit less carbs or a little bit less fat, or we kind of switch things around about when you're eating your meals, that can also play a role and kind of help get your weight loss going too. Your movement, what are you doing when you go to the gym? Are you going to the gym and are you just kind of casually walking on the treadmill versus, strength training or pushing your weights? Are you, when you're telling me you're going on walks, are you like is it just a leisure walk? Well, that's great. Leisure walks are awesome. Love them. But, we have different exercises are going to serve different roles. And so, if all you're doing is leisurely walking, then maybe we need to bump it up a little bit, get your heart rate going a little bit. So there's so many different things that factor into your caloric deficit. And also, are you sleeping well? If you're not sleeping well, that's going to affect your cortisol levels, it's going to affect your hunger hormones. So that's also important. So sleep, stress management also plays a role in this. So whether you're just kind of in a chronically high stress day-to-day life, or maybe you're doing like high intensity exercises every single day and you're under fueling, all of this is going to play a role into your caloric deficit and your ability to lose weight. And so many things to factor into, but, I don't like when people just ultimately think that they just kind of have to keep reducing their calories and reducing until they're eating ultimately nothing and they're not, able to sustain their health, because yes, losing weight is important, but we want to focus on making sure we're losing fat and that we're doing it in a way that's going to sustain our health long term. Because if we ultimately lose weight and we become, we reach our goal weight, whatever that may be, and we don't feel well, we're tired, we can't get out of bed, we can barely walk to the mailbox, then are you happy with your end result? I would beg to differ. And so we want to make sure we're doing things in a healthy manner. And sometimes it's just better to have another set of eyes looking at, all of these things and helping you through it. So